So another major aspect of athletic training is orthopedic evaluations and note taking. Um, Orthopedic evaluations are, just like the orthopedic physicians do. They incorporate special tests, palpations, range of motion, and manual muscle testing to evaluate a patient for injury, for some sort of myofascial restriction, some sort of dysfunction. The most common form of notes we take or write up on orthopedic evaluations are called SOAP notes, and it's an acronym standing for Subjective, Objective, Assessment, and Plan. Another aspect of orthopedic evaluations are palpations. It's using your hands to, feel, in the attempt to feel what's actually going on. You can feel any form of deformity, any thickening of the scar tissue, formation of scar tissue. Um, you know, look for a divot in a muscle tear. Things like that. So the most important thing to remember is to always palpate with a purpose. Have a reason for doing what you're doing. Touching what you're touching. Orthopedic special tests help with the differential diagnosis of an athlete's injury. They involve hands-on, straining of joints to test ligaments, to putting the body through a different range of motion to initiate, the symptoms that they're having. With orthopedic special tests, we try to use pain as a guideline. So when we're working to recreate symptoms of pain or mechanical symptoms, we use, when they have pain or if we feel laxity in a joint to determine, whether it's a positive or negative test. Following the SOAP note format, it literally takes you through your evaluation. Subjective, what you collect from the patient, what you hear from the patient, not observe anything, it's what they tell you. Now, objective is what you observe from, visually seeing the patient, touching the patient, special tests, range of motion, and manual muscle testing goes in that section. Then assessment, you come up with your injury assessment, and from there you determine that through differential diagnosis. And then your plan, whether you need to refer to a physician, they need time out from playing, or that it's something they need to rehab. So now I will have you practice an injury evaluation. As you do the evaluation, you will write up a SOAP note. I'll work with each of you individually, and so I will act as your dummy, providing feedback and helping you as you go along and do the evaluation. Okay, Abby. You have a SOAP note. You're all ready to go. Okay, I'm going to pretend to be your athlete. Say I'm coming in with a right ankle injury. So you take me through the evaluation and write the SOAP note as you go.
Okay. So what hurts?
My right ankle.
So this one?
Yes.
Okay. How did it happen?
I was playing soccer.
Okay. What exactly were you doing when you were playing soccer?
I was running.
And it just gave out on you?
Yeah, it rolled inwards.
Okay. All right. Have you ever hurt it before?
Yeah, I've rolled it before.
How long ago was that?
I have no idea. It's been a while, I guess.
A while? Okay. On a scale of 1 to 10, 10 being you want me to cut off your foot right now, and 1 being no pain at all, what's the pain in your ankle like?
I would say where their pain was and what their pain feels like?
No, I did not. So, where exactly is your pain?
Right on the outside over here.
Okay, and what does it feel like?
Typically, it's been achy, but then when doing something, it's kind of like sharp and stabbing.
Okay, all right. Now I'm going to start doing palpations, and if I touch anywhere that hurts, let me know.
Make sure you palpate with a purpose.
Okay. Any of that hurt?
Mm-mm. You can palpate a little harder. I'm not fragile.
Just don't want to hurt you.
Slow down. Okay, that hurts.
Okay. How?
It's like sharp, like
Okay.
right there. Yeah, it hurts. Fine back there.
Okay. How about right there?
Yeah, that hurts.
Still a sharp pain?
Yep, same pain.
On a scale of 1 to 10.
Like 6 when you touch it.
Okay. Okay, so now I'm going to test your range of motion. And first we're going to do active range of motion. So go ahead and can you bring your toes to your up to your face? Okay, and now can you put them toward the ground? All right, and now can you bring them in? Good, and then can you put them out? Okay, did any of that hurt?
Yeah, bringing it in definitely did.
Okay. All right, first I'm going to dorsiflex your foot, and then I'm going to plantar flex your foot.
Yep.
Relax. I'm going to bring it in, and I'm going to bring it out so I can see the range of motion for one of your ankles that doesn't hurt. All right, next we're going to do this one. Let me know if any of this hurts.
It's a little sore.
Okay.
Yeah, that too.
Okay.
Yeah, that hurts a lot.
Okay.
And that a little bit.
Okay. All right. Next, we're going to do resistance range of motion. So you're going to relax your feet, and I'm going to pull down, or actually, you're going to push. You're going to push against me. Okay. And next, you're going to push up against me. Okay. Now you're going to push out against me. Okay. Now you're going to push in against me. Okay. Now I'm going to perform special tests on both your feet, and I'm looking for pain and joint laxity.
Laxity.
Laxity. Okay, laxity. First, before I forget though, I'm going to make notes about your range of motion. All right. Okay, so I'm going to start with this one. Is that correct?
Yes.
Okay.
What test is that?
I don't know.
The anterior drawer.
Okay. And then I'm going to pull down.
No, put your hand placement on the top of the foot.
Oh.
Yep. Now push down in the opposite direction.
this foot. Let me know if there's any pain.
Did you forget any tests on this one?
Yes, I forgot. What is it called?
Quaggers?
Is that named after the guy that discovered it?
Yes, I believe so.
Okay. So I'm gonna put it in dorsal.
No, relax. Okay, you're gonna dorsiflex the foot
Dorsiflex the
and then
foot.
evert it.
Okay.
So check your hand placement. Okay, dorsiflex and evert. There you go.
Okay. So now I'm gonna do the same thing to this one.
Yes, I have pain with that.
Okay.
That motion, that one's fine.
Okay.
I feel like compression there on the outside.
Okay.
Yeah, that one's the worst though. That one hurts.
Okay. Now I'm going to
No. There you go.
dorsiflex and out. That one hurt?
No, that one's fine.
Okay.
Okay, Abby. Now, based on your subjective and objective gatherings, what's your assessment?
I would say that you have a grade 1 plus sprain of the ATF and the CF ligaments of the right ankle.
Okay, now what's the plan?
I would just say the RICE method.
Okay,
So
good.
rest, ice, compression, and elevate.
Yep. Okay, so now that we've practiced and went over orthopedic special tests, evaluations, and how to write up a SOAP note. A lot of you did really well. Just a few little things you need to work on, but it takes time and practice. So, athletic training, one of the major aspects of it is, orthopedic evaluations. And then, an aspect of that is, being able to write up a SOAP note as you evaluate an injury. And then, there's a ton of special tests out there.